So anyway, I'm with Utkarsh Jain, and how are you doing today, Utkarsh?
I'm doing great. How are you?
Good, good, good. Yeah, and I'm just very happy to announce that Utkarsh uh, is attending Wharton, which is where I attended. I got my Wharton shirt on, so it's nice to have that in common. And Utkarsh, let's just tell me a little bit about your story. I mean, obviously, you've created this company. It's fascinating. I've done a little bit of research, just looking at your website. But tell us a little bit about the story behind it and how you got to where you are today.
Yeah, of course. I was born in India. I moved over to the United States when I was two, and in high school, I really wanted to become a physician. So I chose the University of Pittsburgh because it had a really good reputation for producing physicians and medical students. I learned very early on that I did not want to practice medicine directly, at least. But it was still a good decision. I met my wife in the first ever class I had at the university. We got married a couple of steps from where we first met.
Cool.
In undergrad, I graduated in 3 years, got degrees in applied mathematics and neuroscience. And in my third year, I had to take, oh, I didn't have to, but I chose to take a class in data mining. And I had to do a capstone project, and I couldn't help but think about my grandfather's story. One day he had chest pain, headaches, and nausea. He went to the hospital to figure out what was going wrong. And after some preliminary testing, they believed he was having a heart attack. And so they prescribed him blood thinners. But what ended up happening was they discovered he actually had a stomach ulcer that presented as chest pain. And the decision that they thought would save his life actually cost him his
Wow.
life.
Wow.
And that just got me thinking there should be a more objective way to deal with cardiac origin chest pain or the identification of cardiac origin chest pain.
Right.
So we use the most commonly administered diagnostic test for chest pain, the ECG, and we try to predict whether or not the chest pain is actually caused by the heart. And the way we do that is by a prediction of coronary artery disease and its severity, presence, and impact. Obviously, when I first started this project as an undergrad, I did not have many resources. I did not have many connections. So the first model was not very good. But I put that in my back pocket, applied to a couple of PhD programs, was lucky enough to get to the University of Pittsburgh again, this time for bioengineering. And in the second year of my program, I was attending a seminar, and it was with one of my future mentors, Babs Carrier, and she was talking about the importance of benchtop to bedside and how important it is to not just create research and do research, but also focus on that commercialization. Her tenet was the most powerful thing is the same person who conducts the research is actually in charge of commercializing because they have a vested interest in the success of that research being commercialized. And she called on people in the audience and she called on me, and I told her about the project I worked on in data mining, and she said, "Oh, that sounds interesting. Why don't you try commercializing that?" And I looked over to my friend Adam that I'd known for around a year and a half at that point, and I just said, "Hey, do you want to start a company?" And that was the beginning of Heartio. We have been able to do a lot of great things. We raised a couple $1 million. We got FDA breakthrough designation. We validated the technology in multiple studies of 1,600 and 16,000 patients. We won a lot of awards. We were recognized as both Pittsburgh Business Times and Forbes 30 under 30. And now we're trying to raise a little bit of money to commercialize the product, which has been, a little bit difficult in this
Sure.
current environment, especially with the new administration and
Sure. Oh, change
geopolitical
it.
issues as well.
So what year did you actually start then? It sounds like you've been at this for a while, and I'm sure over that period of time, I mean, AI models have evolved very rapidly and have
Yeah.
gotten a lot more powerful. So just tell us again, without revealing everything, of course, but so I mean, how do you incorporate AI into the solution? What's sort of the what's the user experience, I guess? Tell us a little bit about how the product works.
Yeah, of course. So the product itself is an API. You submit a electronic ECG signal and you get either a report or just a JSON file or a JSON string with the output that you're interested in. Right now, we're able to do a variety of different outputs: coronary artery disease severity, a binary decision for that, exactly where the lesions are located within the arteries, FFR predictions, fractional flow reserve, which is an invasive test that's used to gauge the flow within an artery using a pressure wire. We're able to predict that with a pretty decent accuracy without a pressure wire with just a non-invasive ECG. And currently, we're running a study on PET CT and trying to predict coronary flow capacity and coronary flow reserve. So, there's multiple different ways to analyze coronary artery disease. We're trying to do everything with just a non-invasive
Right,
ECG.
right.
Yep. And in terms of the user experience, it's we try to make sure that the information that we present to the physician or advanced practitioner is very similar to what they've read or what they do in their normal daily practice. So instead of coming out with something that is super foreign to them, our coronary angiogram visualization looks exactly like a coronary angiogram drawing. Our when we did SPECT analysis, our output was a spec bullseye that they've seen in other reports. Same thing with fractional flow reserve. It's a very similar to what they see in CTFFR. So it's trying to deliver similar information just with a different input than they had before. In terms of where the AI comes into place, the it's very difficult for a physician with their naked eye to analyze an ECG and predict all this information. Not saying that uh, it's impossible, but at the end of the day, people are people and they can't
Sure.
look at everything at once. Especially during the 1970s, 80s, and 90s, there was a lot of work done, and a lot of research done trying to understand how vector cardiography, which is analyzing electrical outputs from the heart in three dimensions, and how that correlates to coronary artery disease. And a lot of work was done on that. And they found a lot of different features that correspond to different levels of coronary artery disease. But our theory is that our model, which is an AI deep learning model, is able to analyze all of these features at once,
Yeah, yeah,
so,
yeah.
which is something that a human can't do. I mean, you could sit down and probably look at one singular ECG, map out all the different non or abnormal features in that ECG for a year, and maybe you'll come up with a good self model for that particular ECG. But it's very difficult for a human to do that. And I think that is how we allow physicians to really focus on what they're good at, which is managing patients, determining the disposition plan and all that, not, reading ECGs for something that they normally can't do. And, we really augment the physician's abilities in
Oh.
that way.
So you basically have trained the AI model with that history of
Yeah.
all the ECG data, correct?
Mhm.
And then based on what they read from the patient, they're able to sort of, I guess the AI is able to look at your model and then predict based on what they're reading from the patient, what the potential whatever outcome or risk is for the patient. Is that sort of in layman's terms?
Yeah, correct.
Wow, fascinating. Congratulations. Like, especially if it's not invasive. I mean, that's just an unbelievable win.
Yeah, the one story I like to tell is one of my best. He'll probably hate me telling the story,
Yeah.
but one of my best friends, he's 29 years old, about to be 30, and I think he is 30 now. Actually, he just had his birthday, so he's 30 years old, and he was a Division I soccer athlete, really fit guy. He does a lot of great stuff. He's probably overworked, but he kind of likes it that way.
Yeah.
But he was having chest pains one day, and
Wow.
one cool things that we were able to do is actually transform a one lead Apple Watch ECG
Yeah.
into a medical grade 12 lead ECG, and then put it through our software.
Oh my goodness.
And we did that, and we found that he had a 60 to 70% lesion in one of his coronary arteries, which is not great for someone who's 30.
Yeah.
And he went to a cardiologist to corroborate this. They did a CT with contrast, and they were able to verify that yes, he does
Wow.
have an issue. And now he's on medication and is able to um, you know prevent any further
Wow.
accumulation of plaque, so to speak.
Sure. Sure. Wow. What a great story. What are some of the challenges and lessons that you've learned along the way? I mean, it's obviously it's a great application, and when you hear stories like that, I mean, it's just unbelievably life changing potentially. But tell us a little bit about your journey and again, challenges and lessons learned.
Yeah, I think that, when you start out with a startup, and especially if you're still a grad student, you have this, really romantic idea of what it means to run a company. And you think that it's going to be, all sunshines and rainbows, and everyone's going to think that your idea is great and it's going to be perfect and there's going to be no issues moving forward. But you learn very early on that one, it's not like that at all. And two, you need a lot of help. You cannot do anything on your own. So one of the most important decisions you make is who do you, work with for the rest of your time at the company. And some co-founders that we started with are no longer with us, and some co-found and two of them are still with us, and are probably a couple of my best friends. But
Yeah,
I like to say we're not a family, we're a team. We are accountable to each other
yeah,
and we expect high performance. So I think that is number one, making sure that the people that you pick for your company are the people that are going to be there through thick and thin. The second thing is, how do you deal with it at adversity? And
yeah.
that could be from other people. I remember a situation where we were in Starbucks and I was just talking about our pitch deck, and then a cardiologist came up and he said, I don't believe you. This is not
Oh,
going to
really?
work. This is not going
Yeah,
to happen.
yeah,
And we weren't talking to him. We were just, he just overheard us. And believe it or not, that happens quite a bit. But I think our job is a lot of it is taking in all this information and understanding why someone feels that way and taking that as constructive feedback to how can we better explain this, or what do we have to say
yep,
to convince physicians and people who might end up using the product. And even though it's in that moment, you're like, oh, I can't believe this person said this, or I
yeah,
can't believe he doesn't believe us. I can't believe this and that. Whatever feedback you get is good feedback, and it's up to you to figure out, how do you incorporate it? Do you incorporate it at all? And that's, a skill that you continue to have, and to continue to build. I think the other challenges is just generally speaking, raising money is
yeah,
the most difficult thing you're probably ever going to do. Getting people to trust you with their hard-earned money, and you taking on that obligation that you're going to give them a return that's worth their time, that's outsized in comparison to the market, and it's the best use of the money that they currently have, which is a hard ask, right? Like if you
sure.
have a certain amount of money, um, and a startup is looking at you and you're thinking, hey, what can I get with this money? I can put it in 100 million different places.
Yeah,
Why should I choose you? And I think that it is a hard thing, and I think whenever someone does invest, it really makes us want to prove them right. And I think
sure.
that keeps us going. But obviously, you're very sensitive to geopolitical issues. You're very sensitive to policy changes and interest rates and, hype cycles and all that. So it's not as straightforward as you would hope it would be. But it's, a grind to, get meetings and get in front
Sure.
of people and work on your pitch deck and work on your messaging and customize it for the audience and all that. So I would say that is one of the biggest challenges. And in terms of regulatory environment, the FDA is an organization full of people.
Yeah,
Sometimes your missions get passed down from one person to the next person,
yeah,
and the working theory that you had with the initial person is no longer valid with the second person. So that you have to roll with that, and sometimes you have to do some re-explaining, and the meeting minutes that you had before maybe don't hold up with the second review, or
right,
so on and so forth. So it's always a process, and but everyone has to go through it, and they have a very difficult job,
right,
and
right.
we want to make sure that we make it easy for them, and they want to make sure that they make it difficult but fair.
Yeah,
So
right,
um,
right.
that is at least how I see it. So I would say those are the adversity, fundraising, regulatory challenges.
Sure.
On top of that, you have to, if you're a small company, like I have to build the product a lot of the time. You have to get your hands dirty. So
What's your time frame for, whatever best case scenario, I guess, or for coming to market?
Yeah,
With
we're trying to raise a bridge right now, and
yeah,
then a subsequent equity round.
yeah,
If we're able to get that done, let's say by the middle of the year, that would allow us to start our pivotal study and submit to the FDA sometime in 2026, and then hopefully hear back in 2026. And then we have a couple of clinical partners like the Cardiology Consultants of Philadelphia, which is the largest private practice of cardiologists in the country. That their CEO is already an investor, and he
oh,
wants to
cool.
use this in routine practice. So
Yeah,
as soon as we hear back from the FDA, hopefully we can just flip a switch and then we can make sure that they are able to use the technology on any patient that walks in through the door.
cool, cool. What about the perception of like an AI powered tool, in a healthcare context? I mean, have people's attitudes sort of changed? Have they warmed up to it? I mean, what type of reception do you get?
So I think it really depends on the generation of
Yeah,
people. So when it comes to physicians, at least, there are, the old guard that has their way of doing things. And then there is a newer generation of physicians that have grown up with the technology that, can see its benefits and are eager to use it. I don't know what the, percentages are, but I think that there is a unnamed third category that is probably the majority where they just want to do right by their patients. And what they want to do is they trust data and they trust what are the best ways of helping their patients, right? I'm sure at some point people didn't want to use MRIs or
yeah,
CT scans because it was a new found technology and research hadn't been done yet. But over time, you develop this corpus of evidence that says if you don't use this, you're actually putting your patients in harm's way. So I think that that is sort of the mindset that I have. Obviously, there are these people that think it's a black box. That's they don't want to use it because they have their own ways of doing things, and if you can't explain what the model is looking at, then it's not worth using. And that is their opinion, and they can have it. But I generally don't think I'm trying to convince that type of individual. I'm trying to convince the people who are eager to use it and the people that trust data. And by generating this corpus of evidence. Where we can, show them, hey, this is something that will benefit the patient and will save the healthcare system money.
excellent. So, what's the best way for somebody, whether they're an investor or a prospective customer, to contact you?
Yeah, you can go to our website, heartio.ai. You can also email me directly at utkars.jain@heartio.ai. I am pretty responsive through email. And if you want to collaborate or if you are a prospective investor, you want a pitch deck, I will be happy to share it with you.
Excellent. Thank you so much, Utkars. This has been extremely informative. Very
Yeah, of
happy for you.
course. Yeah, well, thank you for having me.